Hello everyone and welcome to another Stat 437 lecture video. In today's video, I want to introduce the concept of a mixed effects model. So the idea basically is that we're going to be setting aside the marginal models that we've been talking about in the course so far, and in place start talking about this new modeling paradigm that we're referring to as the mixed effects models. So to sort of motivate why we might care about this, what I want you to think about is that the marginal models that we've been talking about so far, they take the idea of a generalized linear model, which we can fit to any type of data, and they expand that to longitudinal data by allowing us to specify a correlation structure. Okay, so we don't sort of specifically model why there's within person variation, but we just say that individuals' measurements over time are correlated according to some correlation pattern. And then we fit some models. We don't need any distributional assumptions. And out of those models, we get these population averages. Right? So the idea with the mixed effects model is that we're going to be a little bit more explicit with what we're specifying, and in doing so, we're going to be able to model at the individual specifically. Okay, and so I would, start thinking a little bit about why we might have questions that are coming up, in science or beyond, that require this individual level modeling approach, and, sort of thinking about how the marginal models that we've been talking about up until now might sort of fall short for those goals. So with that, I will open up my slides here and we can start talking about mixed effects models. So we're, moving from population to the individual. So as a motivating example, consider this news release headline from March of last year. And it says, Ontario is moving 3 regions to new levels in the COVID-19 response framework. Okay. And so if you, watched all of the example videos that I've put out, you know that we sort of modeled the positivity rates of COVID-19 in the different public health units within Ontario, right? But with those marginal models that we were fitting to that data, we sort of had to characterize the individual public health units based on their size, or at least that's the way that we did it. You could have thought about other factors that might influence it, but the idea is in those models, any 2 public health units that are the same size are going to have the same predicted values, and that's because we're, predicting at the population level. So any 2 observations that have the same covariates are going to have the same predicted average when you're talking about it at the population level. But of course, we know that, in the maintenance or in the management of this pandemic, we're sort of looking at individual regions as their own unique observations, right? The occurrence of the case outbreaks is going to differ based on where you are, and certain regions are going to require more input than other regions, and even regions of, say, similar size or similar demographics or similar, you know, other behaviors within the region, right? So each region is going to have its own individual effect. And so if you want to start making conclusions that sort of motivated the government to institute that response level framework where each region could be put into a different response level, you need something that's going to be able to model at the individual level. So we can start thinking about the variation in longitudinal data, right? So ultimately, this is sort of the crux of what we're doing in this course is we've been talking about within and between subject variation. And the longitudinal analysis is primarily concerned with breaking down those 2 sources, right? And we have talked about how you need longitudinal data in order to answer questions that rely on within subject variation over time. You need to take repeated measurements within a subject in order to correctly estimate that. But so there's these 2 different sources of variation that we sort of think about in a longitudinal study. And so there's this question that you might be able to ask yourselves, or it's worth asking yourselves, and that's when we're thinking about this within subject correlation, why is it that we tend to observe positive correlations within subjects, and why are those correlations not exactly 1? Right? So put differently, if we're going to measure the same outcome on an individual over time, we have said that those measurements are likely to be correlated and they're likely to be positively correlated, but they're not going to be perfectly correlated, right? If we measure the blood pressure of an individual every day for a year, you'd expect that there's going to be a high correlation, but every day we're not going to get exactly the same blood pressure measurement. And I think we sort of intuitively know why, but that's because there's, differing sources of variation within an individual that cause this. But so there's three main components that we think about that explain this within person variation. So the first is that between patients, we have heterogeneity. So if you're thinking about, say, a clinical trial where we're giving a treatment, a new drug to patients for the treatment of some illness, right? Some patients are going to be high responders, some patients are going to be low responders. And that, might be explained by something in their uh, genetics or whatever the case might be, but there are going to be some people who respond positively and some that just respond negatively. And so there's this sort of separation of individuals. But a high responder is always going to be a high responder, and a low responder is always going to be a low responder. And so if you think about some patient that's going to respond better than average to a treatment, well, every measurement we take of them, we'd expect them to be better than average. And so then we sort of have that positive correlation there. But there's also within individual biological variation, right? And so we know that the biological processes inside of a person are quite complicated, right? We can't perfectly model them to the data. And so because of that, there's just noise day to day, right? There's a lot going on in your body that's going to make your heart rate higher one day than on another day, right? And so that sort of forces that correlation to be less than one, right? And the other piece about this is that you're more biologically similar the closer in time, right? So if you take a measurement today and a measurement tomorrow, you would expect those to have a higher correlation than you would if you take a measurement today and you take one, 2 years from now, right? And so there's also this idea when we started talking about these correlation pattern matrices that we are often going to see correlation decaying over time. So if you use an exponential or an autoregressive correlation structure, we're sort of embedding this decay over time with them. And, that's sort of explained through this biological variation. We're also going to have measurement error or sampling error or whatever else, right? So every time that you take a measurement, it's of anything, it's sort of only as precise as the tool that you're using, but there's also going to be, times that that tool messes up or that, for whatever reason we don't get a clear measurement, or there's just going to be sampling variability, the exact second that you're recording something, if you had recorded 1 second before or a second after, maybe it would have changed it slightly, right? So we have this sort of measurement error or sampling variability as well. And so these three sources sort of explain the motivation behind the correlation structures that we've been thinking about, right? So we're going to have positive correlation within an individual, but that correlation is not going to be exactly one, and we're going to tend to see it decay over time. Okay, so that's sort of where we're thinking about this variation coming from. But if we're thinking about how we account for it in marginal models, we didn't make any explicit assumptions about where that was coming from, right? So we just said, these are the patterns we expect to observe. We didn't talk about why we expect to observe them or how they sort of came into the model in any individual. We just said, we're going to see a correlation pattern that follows some structured matrix that we set forward. And we went from there. So we didn't make any explicit assumptions about this. We didn't try to encode, the people who are high responders. We didn't give them a term in our models for being high responders. We just said they're going to be highly correlated, right? And so because of that, we're sort of just modeling at this population level, and we're taking this correlation structure for granted. But we didn't necessarily have to do that, right? So this is the diagram that sort of gives us the way that we could think about doing this modeling, right? Where here we have our variate of interest, and it's going to be impacting our outcome of interest, say just at a single time point here, right? And so there's going to be some effect that's just constant across the population or averaged over the population, right? And then we have all of these individual level effects. And in a marginal model, we sort of just take all of those individual effects and we say we're going to capture them with our R matrix, right? And so that's going to force individuals to be sort of correlated over time. But you could think about doing this a little bit more explicitly. You could think about specifying these effects a little bit more explicitly in a model and sort of explaining the variation directly. And so what if you think about doing this at the individual level? Okay. That's where we're going to get these mixed effects models coming in. So the idea is going to be to specifically account for the within person variability by explicitly indicating how the outcomes are related to individual level factors. Okay. So, back to that diagram here, instead of just sort of grouping all of these sources of individual correlation together, we can think about actually sort of modeling them, right? We can think about actually saying there are some patients who are going to respond better to treatment than other patients, or that, sort of capturing this within person variation more explicitly. Now, this diagram is going to be slightly misleading for what we actually get to when I show you what a mixed effect model actually is. In actual fact, we're normally not going to be able to separate out biological variation from measurement error. And the reason for that is that, a biological variation is sort of fluctuations due to your biology. Measurement error or sampling error is fluctuations due to the instrument you're using. And unless you can take repeated measurements, it's not going to be obvious how you sort of separate out those two sources there. But if you're thinking about it at the level of there are going to be patient level effects, there's going to be individual variation either due to biology or to the measurements, and then there's going to be population effects. Those three groups are sort of going to be how we think about these mixed effect models that we're introducing here. So we could actually think about trying to construct this, right? So we have our outcome here. We're going to say it's yij, so it's the outcome for the ith individual at the jth time. And, so far we've been thinking about this as some sort of population average, right? So we have our vector of covariates that we care about, and we have our beta term, which is the parameter vector for the population averages. Okay, now onto this, you could think about adding this term bi here, right? And all bi here is going to be is a term that differs for every individual, right? So that's the subscript I, but it's constant across the time points for the individual. And all that's going to do is shift our observation depending on whether bi is positive or negative, right? So you could think about for the people who have our sort of our positive responders, right? You could think about bi as being a large positive value. And then for the same values of xij, if you have a positive bi, you're going to have a higher outcome. And if you have a negative bi, you're going to have a lower outcome than the population average would expect. So this bi term here is sort of capturing this patient level heterogeneity, right? So for the same covariates, you can have different responses now. And then we can think about having this within individual measurement variation, right? So this term, this epsilon ij term, should be quite familiar to you from your regression courses, where you're sort of adding on an individualized error, right? So at every measurement point for each individual and for each time point j, we're just going to have some random variation that, it doesn't sort of mean anything. It's not connected to our variates. It just happened to be sort of, a higher measurement than normal or a lower measurement than normal based on this average, right? So we're thinking about these first two terms together here as capturing some sort of actual explanatory average, and then we're thinking about this epsilon term as being sort of noise on top of that. Okay? Now we could also make this slightly more complicated, right? So we start with the same population level effects, but now instead of adding on this bi term, what if we added on xij times by bi? So now here, bi is going to be a vector, right? The same size vector as beta, except what we're doing is we're letting each individual to have a different response for each of the different variate values. Okay, so if we think about this a little bit more, you can see that we could group this beta plus bi together, right? So then the response of any of our variates is not going to be given by beta, it's going to be given by beta plus bi, right? And so then if someone's responding a lot better to treatment, they're going to have a bi value corresponding to the treatment covariate as a higher positive value. But you could also think about, perhaps there's someone who, if we're including something like height in the model, where they actually have a bigger effect on their height than normal or a smaller effect on their height than normal, right? And so the total effect for any of our individual variates here is going to be given by beta plus bi. And then, of course, we still need this individual variation, right? And so we can think about that first model as being sort of a special case of this model, where instead of xi here, we've just included the intercept term, right? And so this is sort of the more general case. And you could also think about doing this where we don't use exactly the same variates in both of these situations here, right? So where perhaps we just use a subset that are going to change at the individual level. But the basic idea is that we have an effect that explains population averages. We have an effect that explains individual response, so patient level heterogeneity. And then we have an error term, which isn't actually explanatory for us, but that captures this idea that every time we take a measurement, we're going to see some level of variation on it, right? And by modeling out explicitly here, we have to sort of pay the price of having an explicit model for the whole process. But what we're getting out of that is now we can say at the individual level what is happening, at the population level what is happening, and how much overall noise are we sort of exhibiting in these data, right? And so that's going to be the basic idea of a mixed effect model. So for some terminology, when we talk about those population level effects, that the beta term in the last slide, we call those fixed effects. And so they're fixed across the population, so we call them fixed effects. We refer to the individual level effects as random effects. Okay, and we're going to sort of motivate that terminology a little bit more in the next lecture when we dive into the details here. But the idea is that if it's a term that varies individual to individual, then it sort of varies randomly, and we call them random effects. And then when we have both fixed effects and random effects in a model, we have a mixed effects model, right? So that's where the term mixed effects model comes from. So as a brief summary, we have marginal models, which we talked about as population averaged models. And so they don't account for specific sources of variation explicitly, right? We've indicated there is going to be some correlation, but we don't sort of explicitly specify where that correlation is coming from. What it means, though, is that we can't actually estimate the individual effects themselves, right? We can only talk about the whole population because we haven't sort of modeled the process by which that individual level variation is coming from. A mixed effects model, on the other hand, is going to specify fixed effects, which are population level, and random effects, which are individual level. And by specifying the structure in this way, we're going to show in sort of these coming lectures that this induces a correlation within the individual, but also it's doing it in a very specific, explicit way. And what that means is that we can use those estimated parameters in order to sort of talk about the individual level data that we might care about. So in the next lectures, we're going to be talking about how to specify these models in more detail, and we're also going to talk about how to estimate them in some level of detail. And so I guess just to conclude here, this has obviously been a fairly high level overview, right? But what I'm trying to do with this is just motivate the idea. Why do we need these mixed effects models? Well, there's a problem with the marginal models that we've been fitting. And, they're quite powerful when what we care about is the population. But if there's some, process that might be interesting to us that's causing this variation to arise at the individual level, well, explicitly modeling that is going to give us more power and more flexibility to make decisions. So again, think back to, the Ontario government trying to make decisions about what to do in the COVID-19 pandemic, right? It doesn't so much help them to have averaged data for, regions that might be similar demographically. They want to be able to say, for this region specifically, what should we do? And in order to be able to make those decisions, you need to have data that's being modeled at the individual level. So these mixed effects models are going to give us that power, but they also give us the ability, as we've been pointing out, to talk about the population level, right? And so while marginal models can only do population averaged effects, these mixed effects models are going to be able to do both population level and individual level effects. And so they're sort of more powerful in that way. We make some other sacrifices with them, which we'll talk about explicitly. But I hope that sort of makes sense as to why we need them and how we're going to go about doing them. But of course, in the next video, we're going to go through all of this in full detail, talk about how to actually fit them. And then following that, we're going to see the theory and then some examples of it actually being applied in R. So, if any of this doesn't make sense, feel free to ask me any questions, but hopefully that between this and between the coming lectures, all of this will become crystal clear and you'll be able to sort of understand why we need these models. So with that, I will see you in the next lecture.